Consider enjoying a great lunch. You thoroughly loved it, and wow, are you full. However, after a while, you begin to have a burning sensation in your chest, a rare burp that leaves a terrible taste, and an uneasy feeling in your stomach. Acid from the stomach entering the food pipe is the cause of this, which is known as acid reflux. The condition is known as gastroesophageal reflux disease, or GERD. When these symptoms begin to occur regularly, such as more than twice a week, 1 in 5 persons are affected by this widespread issue. GERD may be prevented and managed well. But how do we do that? Before we continue, a brief request from us. If you find value in this video, please don't forget to subscribe and hit the notification bell so that you don't miss our valuable content on health in the future. What is acid reflux, and why does it occur in the first place? The ability to digest food is a wonderful gift. It manages all of the various meals and beverages we ingest and guards against many pathogens that enter our bodies. The esophagus, often known as the food pipe, via which food travels to our stomach, serves as a strong food grinder after we have finished chewing and swallowing. It breaks down the meals into easily digestible parts. The stomach contracts and squeezes to break down the food and squeezes out powerful chemicals and acids, so that our intestines can digest it and our body can absorb all the nutrients and energy from the meal. Food that is high in fat or protein requires more acid in digestion time. Our stomach walls are constructed specifically to withstand this demanding effort at the opening of our stomach. This is a certain muscle that functions as an entrance gate. It first opens to let food in, then shuts to prevent food, acid, and other substances from traveling back up the food pipe, or esophagus. This muscle occasionally experiences acid reflux or backflow. It causes a burning ache or the impression that food is coughing up in our throat or chest. Gastroesophageal reflux disease, or GERD for short, is a disorder where acid reflux occurs regularly in certain people. Reflux that occurs once in a while is not a major concern, but if it occurs frequently and for a long time, it can cause discomfort and negative feelings after meals and harm the underside of the food pipe. After a substantial meal that completely fills the stomach, symptoms typically get worse. After eating spicy, greasy, or high-protein meals, GERD symptoms may also get worse. Foods that are fatty and heavy in protein need more acid to be digested. After eating, lying down makes GERD worse because the contents of the stomach push upward. Some medical disorders, such as being overweight or obese, place extra weight on a person's belly, which increases pressure on the entrance muscle and causes acid to spill up. Smoking tobacco also worsens GERD because nicotine in tobacco relaxes the entrance muscle. This allows the stomach contents to flow backwards. The effects of some medications, such as those used to treat asthma and high blood pressure, may also cause similar muscular relaxation. Rarely, individuals may have hiatal hernia or another issue with the location of their stomach or diaphragm. The entrance muscle's performance is impacted, decreasing its effectiveness. When should someone be concerned, and what are the symptoms of acid reflux? GERD can manifest itself in many ways in different persons. Heartburn, which causes a burning sensation in the middle of the chest, is the most typical. Additionally, some may have discomfort in the upper portion of their stomach. Watery burps that leave an unfavorable aftertaste, or the sensation that food is coming up. Additionally, GERD can lead to coughing, sore throats, and foul breath. It is crucial to remember that GERD symptoms can readily be confused with those of other potentially more dangerous disorders. For instance, chest discomfort, chest tightness, or upper abdominal pain might also be the signs of angina or heart attack. Stomach ulcers or other issues can also cause abdominal pain and discomfort after eating. For this reason, if your symptoms are new or if they are growing worse, you should visit a doctor or seek medical assistance. Chest discomfort and pain that radiates to the arms, neck, or back are among the signs that require medical care. In addition, there may be other symptoms including weight loss, difficulty breathing, severe stomach discomfort, black stools, and chest pain. Rather than assuming that GERD is responsible for all of your ailments, it is preferable to be safe and see a doctor. What are some methods for acid reflux? Changes in lifestyle, nutrition, and medication usage are all part of treating GERD. With these therapies, the majority of patients will improve and might not require more testing or research. If you have any of the above stated alarming symptoms, your doctor could advise additional testing and treatments. If you have heart disease risk factors or are not improving after receiving first GERD therapies, here are some suggestions for treating GERD. Changes to your diet should be made first and primarily by avoiding or eliminating foods and beverages that worsen reflux. These include fatty or oily meals as well as spicy cuisine. Reduce the amount of oil and spices you use in your meals and snacks. Reduce your consumption of caffeinated beverages including coffee, tea, and soft drinks as well. Caffeine eases the muscle at the stomach's entrance, which enhances reflux. Caffeine should be avoided in the evening, 6 to 8 hours before bed. You can substitute with beverages devoid of caffeine. Second, avoid overeating. Always leave some room in your stomach and only eat until you are entirely satisfied. A full stomach increases the likelihood of reflux. Third, give up smoking cigarettes. The stomach entrance muscles are relaxed with smokes, which results in reflux. Fourth, between supper and bedtime, have at least 2 to 3 hours of free time. The stomach begins to empty after this amount of time. GERD typically becomes worse at night, so try sleeping with your head raised. Use a chair or a couple of cushions to raise your back and head. Be careful to raise your upper back as well. 5. If you are overweight, decreasing your body weight will help you have less GERD. And finally, 6. There are several medications widely available that can help you. Some are taken when you first experience pain or heartburn and provide quick symptom alleviation. If you have a substantially greasy or spicy dinner, you might utilize them in advance. These are typically referred to as antacid medications and come in the form of tablets or syrups. You might also substitute with little quantities of chilled milk. We utilize medications to regulate the quantity of acid produced if these measures do not reduce GERD. Proton pump inhibitors and H2 blockers are prescribed for 2 to 4 week intervals. For the best results, take them at least 30 minutes before meals. Keep in mind to speak with your doctor to confirm that your symptoms are not the result of anything else. You should also speak with them if you require some testing to make a diagnosis so that you can receive the best treatment possible. Gastric acid is really potent. Our stomach creates about a half liter of acid with each meal. Acid that is so potent to aid in digestion of food and extract nutrients, this is crucial. However, it eliminates dangerous chemicals and bacteria that might enter through food or unwashed hands. To keep us secure and healthy, our stomach puts in a lot of effort. Therefore, we should also appreciate it and do what we can to keep this organ in good condition for the benefit of our health. Be reminded that this video is primarily for information only, and we always recommend that you go see a medical professional to get personalized healthcare that will fit you. Do post some of your advice on how to relieve and treat GERD. Additionally, leave a like, subscribe, and click the bell button to receive information on our new health-related videos. If you want to watch more of our content, check out this video in the lower right corner. You can also check out our playlist of related content. Anyway, see you later and thank you for watching.